recently had a period of being in and out of hospital where I could not fault the commitment of
I
staff.
cannot get a local dentist as I have no fixed address.
First-class treatment at hospital, but feel ageism is prevalent in other areas of NHS.
Lewisham speech therapy, very good.
Why do they not do blood tests at my local surgery?
We are an independent group of local people and community groups who represent the views and interests of people in Lewisham. We work together to improve health and social care services.
It would be helpful if we could book the GP appointment one day before.
Access to my GP is difficult at short notice.
The patient says A&E refused to treat her.
It's important to have an independent health and care watchdog that represents the views of local people and holds services to account. We listen to people, we listen to what they tell us about their experiences of health and social care services, and we use this information to influence the way services are run. Services should reflect what local people need and want, and we help to make this happen.
Problem with communication and different dentists every time. I would prefer same dentist.
CAMHS staff at Kaleidoscope provided excellent support to my daughter.
Hi Rosie, I hear you had an accident.
Well, it was about a year ago, and it was a very nice Saturday, September afternoon. I was sitting out in the garden with my husband, and I got up from the bench and climbed along it, not wanting to disturb him, and my sandal got caught in the arm of the bench, and I ended up doing a backward somersault into this gully between our patio and the house wall. I did manage to get up with my husband's help, and we went straight to casualty at Lewisham Hospital. He had to go and park the car, so I was on my own, feeling incredibly shocked and in a lot of pain. The receptionist had her back to me and was talking to her friend and was eating.
Really? That's awful.
Eventually she noticed me, and it seemed like ages until she did because of how I was feeling. And eventually I went to the urgent treatment centre, where I was seen by a medic who considered that it was muscle damage, severe muscle damage.
A bit of a relief for you.
And gave me some painkillers. And by that time my husband had reappeared, and off we went. In the following weeks I was in a lot of pain, and when I thought back on what had happened, I thought, well, you know, that wasn't a very good way to treat me, and that must happen to a lot of people when they have accidents. So I got in touch with Miriam at the local office. She suggested that we got pals involved. She got Sarah to contact me, and then I emailed Sarah an account of what had taken place at the hospital that afternoon.
So what happened then?
Subsequently, I heard that Sarah had been in touch with the head of department responsible for reception at casualty. As a consequence of that, there had been some changes in the behaviour of staff at reception. So that was a good outcome.
So that's good that the team was able to help.
Absolutely,
in that way.
Yes. Yeah. So then, you know, I was still in the mindset that I was suffering purely from muscle damage. I did go back to my doctor because the painkillers I'd been given were making me feel nauseous. He had a look at me as well, but, you know, accepted that the diagnosis that it was purely muscle damage and gave me some different painkillers. By this point, I was suffering such pain down my arms and tingling in my fingers, and I couldn't sleep, and I was using ice packs to try and relieve the pain. And I decided to go to a private physio who listened to what had happened to me, gave me some preliminary exercises on the basis that it was muscle injury, and then she said that she felt that I should really go back to my doctor and insist on having an x-ray.
So it was left up to you to do the potential diagnosis?
Yes. It was 3 weeks after the accident that I went back to my doctor, and then I had to wait another 5 days until I got the appointment because there's a kind of bureaucratic procedure. So it wasn't treated as an emergency. When I finally got to the X-ray department at Lewisham Hospital, the radiologist reacted very strongly to what she saw and immediately took me back down to casualty, and I was then admitted to hospital. So on the first day I was on the ward at Lewisham Hospital, Miriam got in touch with me. I told her what had happened, and she went back to Sarah, who came to see me at my bedside, and she took a full account of what had happened over the previous weeks. eventually I ended up at King's, where, and by this time so much time had passed that the bones were beginning to fuse, to heal.
Yes.
But of course the dislocation became permanent. But the consultant offered me an operation where metal plates would be put into my neck, and by then I kind of was losing the will to live, really. I just wanted to go home. So I went home with a much better fitted neck brace than the one I'd had at Lewisham Hospital, and wore that for about 3 months. After that, I started to go to Pilates classes, and that's been the best thing that's happened to me, actually. The Pilates has been really beneficial. I think the whole thing was a very difficult experience for me, and if it hadn't been for Miriam's support and Sarah's sympathetic listening and her perseverance in pursuing the complaints on my behalf, I would have ended up feeling much worse than I did.
That's good that the team was able to help.
Yes, it was.
I have difficulties getting an appointment. Phones engaged before 8:20 in the
I
morning.
have found the dermatology department to be very helpful, clean and efficient.
If you identify with any of these comments, just put a label. You may want to pass the label. Stop waiting around in GP surgeries. Doctors to give more time. Stop waiting for a week to see a doctor.
Sometimes you have a few more things to say, but the doctor has to tell you to leave. That's difficult.
I do myself.
I agree.
I agree.
GPs could have a better bedside attitude, not just convey about medicine.
I've got 2 doctors, a man and a woman, and they're very good.
I don't know who is my doctor, so they asked me. They said to me, this doctor, you can see this doctor, so I just accept it.
The health service is good, only the dentist is expensive.
Yeah, I think dental care is expensive.
Yes, dental care is expensive.
We attended a workshop at Rushy Green Time Bank. We took a folder containing comments made by local residents about health and social care in the borough. We asked people to place a sticker on those comments they agreed with.
Our social worker has not been helpful at all. She doesn't visit us at all.
Health service is good, but could be improved in some departments.
When it comes to the health sector, young people's views should be put across. I think it's very important because we have young carers and we have young people growing up every day, and such things like diabetes, high blood pressure, or teenage pregnancies, those are things that affect young people very often. So when it comes to the service providers and health sectors and social care, all those things need to take into consideration. What do a young person really need? What do we actually need to help grow up and actually become who we want to be? And I think health is a big thing in everyone's life, so if we actually listen to it, we can make a big difference.